We will also have what we call our spotlight or our education segment, where we're going to hear from Oliva Carpenter with the American Cancer Society, and we're going to hear from Sheila Senyo Gehart with the California Department of Public Health. And then we'll wrap up our time together with some announcements and looking ahead. If you have a particular resource, announcement, or event to share, please go ahead and get that either queued up or ready to drop into the chat, or use our raise hand function when we get to that portion of the agenda and of the meeting. So with that, we always start with a quick review about the cancer campaigns, because we always have new people who haven't heard it before. So those of you who've heard it, just go ahead and bear with us for a moment. We are a year-round initiative that is led by the UCSF Helen Diller Family Comprehensive Cancer Center's Office of Community Engagement. And we come together to increase awareness and align with the different national and international cancer topics, causes, campaigns, or health observances. And what we're doing is together we're amplifying the messages. We have the spotlight section where there's knowledge sharing, there's networking that takes place here, and an opportunity to connect with resources, services, and other events. And with the campaigns, you'll see some of the topics listed on the slide. We are now in the month of April, which has both Cancer Control Month as well as Minority Health Month and Head and Neck Cancer Month. So our cancer campaigns collaboration or initiative is part of advancing the mission and vision of our Office of Community Engagement, which is shared on the slide, focusing on the sustaining engagement, facilitating partnerships, disseminating cancer information and knowledge, and then, of course, advocating for policies to address the structural and social determinants of health. So that's just a brief overview about the cancer campaigns and how we contribute to our office mission. Now I'm just going to take a moment to briefly just go back to our next segment. I'm going to be stopping my share and first handing it off to Oliva Carpenter. And then Oliva, once you take the floor, you'll be able to run your own slides. And then after we'll hand off to Sheila. So she'll follow you. And after the both of you have had your time, then we will entertain some question and have question and answer. And as always, if a person has a question while the speaker is presenting, go ahead and feel free to drop it in the chat. Okay, with that, I'm going to turn it over to Oliva. Floor is yours. Thank you.
Thank you so much, Michelle. Can everyone see my slides okay?
Yes.
Okay, perfect. Yes, so thank you so much for having me today, Michelle. As she mentioned, my name is Oliva Carpenter, and I am an associate director with the American Cancer Society, an associate director of community partnerships. And so she so kindly invited me here today to talk about April being Cancer Control Month, but as well as highlighting our Cancer Facts and Figures report that just came out, and some key messages and some resources. So hopefully you all take back some information that is helpful for you today. Just again, an agenda overview of what I'll cover. Again, our Cancer Facts and Figures, ACS resources and programs, what can you do for the month of April for Cancer Control Month, and some key messages to take home today. So, sorry, let me move this so I can see everything a little bit better. So Cancer Facts and Figures is our most esteemed report of the American Cancer Society. It was published in 1951, and it is known as the gold standard of cancer surveillance research. vital work that analyzes and disseminates data about new cancer cases and deaths to help improve public health. The Cancer Facts and Figures provides an annual snapshot of population-based cancer data for the United States. So who uses our Cancer Facts and Figures? Clinicians and health professionals use this to improve practices for prevention, screening, and treatment of vulnerable populations. Researchers use it to inform current and future studies to discover new breakthroughs. Educators to teach the next group of doctors, nurses, pharmacists, and researchers. Policymakers to build evidence base to create and pass legislation that supports equitable access to quality care. Advocates to highlight opportunities for cancer prevention and control interventions. And then media outlets to amplify and circulate pivotal facts to national and global audiences. I'll be sure to share the slide deck with Michelle so that you all have access, because the cancer facts and statistics here is linked, and it'll take you to our interactive data tools, our annual reports, trends and surveillance, equity and disparities data. And again, this is for our Cancer Statistics Center, so you'll be able to access all of that with this link. And our annual reports, again, includes our cancer facts and figures, and this will have national and state PDFs. There are also special topic reports. Trends and surveillance will include incidence and mortality trends, survival data over time. And then our equity and disparities data breaks down by race, ethnicity, and geography. So you'll be able to access all that with this cancer facts and statistics link up here at the top. Just highlighting quickly a little bit of high level information from our Cancer Facts and Figures report. In 2026, about 2.1 million new cancer cases are expected to be diagnosed in the US.
Yeah.
Prostate cancer is the most common cancer among males, followed by lung and colorectal cancers. Among females, breast, lung, and colorectal cancers are the most common. There have been notable improvements in survival for most cancer types due to earlier detection and or advances in treatment. Overall, cancer survival has increased from 49% in the mid 1970s to a milestone 70% for diagnosis during 2015 to 2021. So almost a 21% increase of survival rates. Um, Survival is lower in Black people compared to white people for almost every cancer type. For example, the 5-year relative survival rate for uterine cancer is 63% in Black women versus 85% in white women. And this is largely due to later stage diagnosis, more aggressive disease, and less access to high quality treatment. In 2026, over 620,000 deaths from cancer are expected in the US. Lung cancer is the leading cause of cancer death among males, followed by prostate and colorectal. Among females, lung, breast, and pancreatic cancers are the leading causes of cancer death. The cancer death rate in males and females combined has declined by 34% since its peak in 1991, with larger declines among men due to a steeper decline in cigarette smoking compared to women. And again, these are just some highlights from our Cancer Facts and Figures report. It is much more in-depth, a ton of information. So if that is something you're interested in, we'll be able to link that as well. So now I'll just highlight some ACS resources and programs. Our first one here that I want to highlight is our 24/7 Cancer Helpline. It provides support for people dealing with cancer 24 hours, 7 days a week. Our trained cancer information specialists help patients and caregivers by providing information on cancer, answering questions, and connecting people with programs and services, offering emotional support. We have over 200 languages via our translation services. Our helpline is also available via our live chat through cancer.org. Um, we also, our cancer.org website, we also have this. It's a highly trusted source of clear science-based content. It educates the public, empowers patients and caregivers, supports healthcare professionals. It has in-depth information on risk and prevention, screening, cancer types. Also has information on financial and insurance matters, coping and survivorship, end of life care. There are also resources to support caregivers and family members. And so you can access all that on our cancer.org website. Some additional features that you can explore is the Anatomy Gallery, which explores interactive tools of human anatomy to help patients understand where organs are located and what they're reading about, in their imaging reports or their other medical reports. We also have a skin cancer image gallery, and we also have dedicated sections for cancer survivors, caregivers, adolescents and young adults, childhood cancer, and veterans as well. We also have a cancer care toolkit. This is a um, printable worksheet that has trackers and a collection of flyers to help cancer patients navigate their cancer diagnosis. The toolkit includes treatment, side effects, worksheets, pain diaries, medicine lists, appointments, test results from, I'm sorry, a test result form, printable lists of questions to ask your doctor. So you can visit cancer.org, Cancer Care Toolkit, or CCT to get started, or to print these if that's something you're interested in. Another program we offer is our Road to Recovery program. This is a free rides to treatment program. Transportation barriers are the number one reason for missed cancer appointments. So we have trained volunteer drivers who donate their time to help patients get to and from their appointments. We are constantly in need of volunteer drivers for this program. So there is sometimes a little bit of delay in scheduling and receiving a ride for our patients in need. So we're constantly recruiting and hoping to put information out there for this program. We have our Cancer Survivors Network. This is a peer support community for cancer patients, survivors, caregivers, families, and friends. It provides a safe online connection where people can connect with similar experiences. They can join discussion boards, join chat rooms, and really just build their own support network online. And you can also visit that via the link down below. Our ACS Cancer Risk 360, this is a tool that allows users to check, know, and reduce their risk of getting cancer. You'll be able to identify key risk areas and get recommendations to improve your overall health. So you go to ACS Cancer Risk 360.cancer.org. You take the test in about 5 minutes. No prep or studying is needed. You get your results and you're able to improve, your whole health based on the information provided to you. The results can be downloaded, printed, or emailed. And this tool is periodically reviewed and updated for accuracy to reflect the latest science. So if that's something you're interested in doing, you can also visit that via the link down below. We also have our screening locator tool. This features an interactive map with screening locations for cervical, lung, breast, colorectal, and prostate cancers by zip code. Healthcare facilities can request updates to their system information within our screening tool by submitting a change request form. And the form is available at getscreen.cancer.org. So if you went here and you looked up your organization and you do screening and it's not in there, it's not up to date, you can request those updates via the link down below. But you can also, I'm sorry, not down below, here in blue. And then if you're interested in using the screening locator tool, you can use that here at getscreen.cancer.org. So for Cancer Control Month, what can you do? I just have a handful of ideas here. some partner activity ideas. So, number one, I have an in-reach campaign. If you are a healthcare provider or you work in a healthcare facility, an in-reach campaign would be doing outreach to patients who are seeing you day of. So, for example, you would set a goal to contact 50 patients during a specific week in April. You could use standing orders to reduce provider burden. Um, Number two, provide uh, provider MA strong recommendation challenge. So essentially having your MAs uh, let your patients know that they're due for screening and then having your provider come in and reinforce that recommendation. Um, it's very well known that a patient is more likely to get a screening completed with a strong provider recommendation. So that is vital when you have a patient in office. It's a great opportunity to provide that recommendation for screening. So training your MA staff on how to, respond to any kind of screening hesitancy, launching some kind of mini challenge between your medical teams. What I've seen with my partners is a lot of these teams sometimes are competitive. So if you kind of make it a fun challenge, you seem to get better participation. Some other things you can do, community outreach and tabling events, partnering with your community-based organizations, food banks, churches, shelters, and hosting tabling events, resource fairs, mobile screening signups. Um, Four, with patient education moments, so using waiting room, TVs, posters, exam room conversations. So just using those opportunities to educate patients on the importance of screening. And you can, pair this with ACS materials that you might already share, or if you're interested, that we can provide for you. And then number five, social media and texting campaigns, sharing did you know screening facts, patient stories seem to be very impactful, and then sending text reminders, you're due for your cancer screening, call today type of outreach. Just some key messages for Cancer Control Month. One here, cancer prevention and early detection saves lives. Why does that matter? Many cancers are preventable or highly treatable when they're found early. Number two, a strong provider recommendation makes the difference. Again, provider recommendation is one of the strongest predictors of screening completion. Number three, not everyone has the same access to cancer prevention. Why does that matter? Disparities in screening and outcomes still exist, as I highlighted in one of my cancer facts and figures slides. Number four, every visit is an opportunity. So anytime a patient comes into the doctor, it is the easiest way to talk to them about screening. In-reach is one of the most effective strategies. And then cancer control is a team effort. It's not just providers, MAs, um, everyone, navigators, community-based organizations, everyone plays a role in improving cancer outcomes. It takes a coordinated effort across the entire care team and a community, in making sure everyone gets screened. And then finally, I have an I Love You Get Screened. This is one of our campaigns. This is committed to helping people learn more about cancer screening recommendations, overcoming barriers to getting screened, and taking steps to get screened. Um, so this campaign encourages conversation about cancer screening by urging people to tell someone they love to get screened. So all of our materials for this campaign has the "I love you, get screened" slogan on it. And these are all online here. So for any public-facing assets, you can visit this link down below. But this would also be, a really great opportunity if you're interested in working with ACS on to either get in touch with me or to get in touch with Mernell Gomez, who we can help with getting these materials printed into you. I think that's all I have. I'll hand it off to Sheila next. So I will end my sharing.
Thank you, Oliva.
Oh, sorry. There we go.
Can everyone see my screen?
Yes.
Thank you. All right. Good morning, everyone, and thanks for having me today. My name is Sheila Senyo Gerhardt. I use she, her pronouns. I'm the Strategic Alignment Specialist for the California Cancer Registry and the California's Comprehensive Cancer Control Program. And we administer the State Cancer Coalition, CDOC, or the California Dialogue on Cancer. Also, my voice is a bit hoarse today, so thanks for understanding. But as I'm presenting, feel free to drop questions into the chat at any time. My team is here and ready to help answer them. And of course, you're welcome to hang on to your questions until the end, where we'll try to take a few if time permits. So for today's call, I'm going to give an overview of the Comp Cancer Program and the CDOC Coalition. I'll walk through who CDOC is and what the state cancer plan covers and how you can use it in your own work. I'm also excited to share a quick overview of the upcoming 2026-2035 state cancer plan, and I'll also highlight easy ways to get involved with CDOC or plug into our ongoing efforts. And since April is Cancer Control Month, I'll tie our work back to the statewide momentum happening right now. I think there's a few folks in this call who has been very active with CDOC members for a long times, but I think it will be very beneficial for those who are just becoming familiar with us, or just to give a brief summary of who we are and kind of logistically where we are too. So this is an org chart here where you'll see CDC at the top. So we are funded by CDC, and then we're housed under the California Department of Public Health. Here within the Chronic Disease Surveillance and Research Branch, which also administers the California Cancer Registry or CCR, as well as the California Neurodegenerative Registry Disease Registry, the BRFIS or the California Behavioral Risk Factor Surveillance Program. So all of those programs, including the Comprehensive Cancer Control Program, is housed under the Chronic Disease Surveillance and Research Branch of CDPH. And then you'll see up underneath Comp Cancer is CDOC, which is the State Cancer Coalition. The Cancer Control Program are charged with establishing our Cancer Control Coalition, which is CDOC. It also assesses the burden of cancer in California, and we do that in collaboration with the CCR. And then our main charge is to develop and implement California's Cancer Control Program. And then again, I mentioned that our infrastructure is dictated by CDC. CDOC is also guided by an executive committee that brings together leaders from across the cancer control community. We have a chair, Dr. Sora Park Tenjasiri from UCI, and co-chair, Dr. Allison Herman from UCLA Johnson Comp Cancer Center. CDOC's vice chair is Bridget Freely from the American Cancer Society. You'll see our small but mighty Comp Cancer staff, where we have Shante Davis Patterson as the program director of Comp Cancer, and Joyce Seha, the coordination support specialist of CDOC, and myself, whose time is split between the Comp Cancer program and the Cancer Registry. You can also visit our website anytime to learn about the executive committee and see our leadership structure. Our coalition has been around for more than 20 years. Our membership has around 220 or so organizations, and we have different work groups that work on our CDC action plan and other projects. And out of the 220 organizations, we have approximately 69 members who are active and who are helping us accomplish our work plan activities. So we have an amazing and committed coalition full of partners who are doing cancer control efforts. We're getting a lot of things done because, as you see, with the Comp Cancer program, it's just our program director, our full-time coalition coordinator, and myself as an in-kind. So it's a small but mighty group, but CDOC provides structure and shared direction so our cancer control partners can collaborate efficiently and effectively. CDOC's mission is centered on reducing cancer suffering and mortality across California. CDOC's priorities are to increase colorectal cancer screening, improve cancer survivorship, increase HPV vaccination rates, improve healthy living, increase lung cancer screening, and our overarching priority is to advance health equity and cancer control. So CDOC is a diverse coalition that brings expertise from different sectors and communities. CDOC members represent government, nonprofit, health systems, academia, survivors, caregivers, to name a few. Community leaders also play an important role in shaping our direction. The executive committee includes the chair, vice chair, immediate past chair, and work group chairs. Additional members can join as needed, ensuring that the committee reflects emerging priorities. CDOC has 4 work groups, each focusing on colorectal cancer, survivorship, health disparities, formerly health equity, and lung cancer screening. Workgroup members join calls or meetings, share expertise, and collaborate to advance statewide goals. So these groups help identify practical opportunities to make real impact. And to participate in any CDOC workgroups, one must be a CDOC member. So some of the expectations of becoming a workgroup member includes participating in workgroup meetings with frequency determined by the workgroup, contributing expertise to the efforts of the CDOC work group that you are involved in, and identifying collaborative opportunities by joining others at the CDOC table who share similar concerns and desired outcomes. CDOC has also liaison groups that bridge our work with tobacco control, nutrition and physical activity, and colorectal cancer partners, such as our long-standing partnership with the California Colorectal Cancer Coalition, or C4. And these connections ensure our efforts align with the support broader statewide initiatives. CDOC co-leads the California HPV Vaccination Roundtable to boost HPV vaccination rates statewide. We also convened the Cancer Centers Collaborative. We connect all the NCI cancer centers and other COC accredited cancer centers throughout the state to help share best practices during those meetings. So in the next few slides, I'll share a quick overview of our state cancer plans. There are comprehensive cancer control plan or state cancer plan in every state in our nation, as well as some tribes and territories. State cancer plan includes strategies that have worked either in that region or in similar places and make them into blueprint for action, and each plan reflects regional needs and data. Again, every state develops a cancer control plan tailored to its own population and data, and these plans lay out strategies that have proven effective and provide a blueprint for action. So the successes of the plan depends on statewide partners and communities working together. The implementation of the state cancer plan is a shared responsibility. So every member of California's Cancer Control Committee plays a part on it. Our program leads the development and coordination process through CDOC, but success truly depends on community participation and partner activities. The previous state cancer plan ended in 2025, but we still want to capture your ongoing work. So if you ever have used the 2021-2025 state cancer plan, we encourage partners to continue reporting cancer plan-related activities to our online form, which my colleague Joyce will drop in the chat. For these next few slides, I'll be giving a quick overview of our upcoming 2026-2035 state cancer plan. It is our first 10-year state cancer plan. It focuses on health equity and prevention to eliminate disparities and improve outcomes for all California communities. It was developed from 2023 to 2025 and is currently in the CDPH approval process. When it's all said and done, the plan will be available exclusively online, and we will, of course, alert everyone when that happens. So, health equity is at the heart of every strategy. Community engagement drives success. Data guides our decisions and evaluation. Policy and system change create long term impact. Collaboration across sectors strengthens outcomes. The plan covers 8 chapters from health equity and surveillance to prevention, early detection, treatment, and survivorship. So for each chapter includes strategies grounded in data and community needs. In addition, we have an evaluation plan measures that tracks how the state is progressing toward the priorities which we set through 2035. So we've also developed a dissemination plan with CDPH Communications to just make sure that the new state cancer plan reaches key audiences. Implementation guides are underway to help health systems, community groups, policymakers, and other audiences to put the plan into action. So when the cancer plan comes out, this will serve as a practical companion guides to help different audiences to put the state cancer plan into action when it's published. So these guides will be ready once the cancer plan is released. April is a time to highlight statewide cancer control efforts and encourage community engagement. All of our state cancer plans show how California is addressing prevention, early detection, treatment, and equity. April is also an opportunity for partners to join CDOC or any of our work groups to participate in events and share resources. Our newsletter will spotlight National Cancer Control Month and include ways to get involved. So it's easy and it's free to join the CDOC, and CDOC is open to anyone committed to improving cancer outcomes in California. In this slide, it shows some of the benefits you'll gain as a CDOC member. Members gain access to trainings, webinars, and meetings that support professional development. Our monthly newsletter highlights resources, events, and funding opportunities. For these contributions, you may email directly our coalition coordinator specialist or anyone at CDOC team. And members can also spotlight projects and recognize partners doing exceptional work at their own workplaces. You can access the state cancer plan, the previous state cancer plan, and the past state cancer plan, and learn more about CDOC anytime at our website. We encourage and invite you all to get involved with our coalition. We invite you to fill our new member form if you'd like to get involved. And I know my my colleague Joyce will also drop the link to our website and a new membership form if you're interested in joining. Thank you again for this opportunity to share this work today. My team and I are here to help answer any few questions, and if you can always reach us for any question at CDOC if you'd like to follow up afterward.
Well, thank you so much, Sheila and Oliva. I just want to ask folks to use a reaction if you've learned something new from either of them, or if there's a resource or you plan to follow up or engage after, because they both have shared a wealth of information. I know I learned quite a few new things and about tools and ways to further engage. So I'm hoping people also will share that as well and follow up with both of them. So what we'll do is we'll go ahead and take a few questions. If you want to raise your hand because it's easier for you to ask the question, we can go ahead and have you do that. Or if you prefer to drop a question in the chat, we'll have both Oliva and Sheila address questions kind of simultaneously, depending on what the question is. I think one of the things I thought I heard from Oliva regarding the cancer facts and figures, it sounded like it's 75 years old, or pretty close to, a milestone in
Yes.
terms of,
Yes. one of the
sharing.
oldest pieces, I think, of information that ACS publishes every year.
Yeah, yeah, that was definitely something I was not aware of that it had
Yeah.
been around that long.
Yes. But yeah,
Let's
since
see.
1951, it's been published every year.
Okay, okay. Well, that's I guess a pretty significant milestone that many of us have benefited from the tool over the years. So with that, let's see. Do we have anyone who has questions or comments for Sheila or Oliva? If not, I want to give folks an opportunity. If not, I will ask a couple of follow-up questions. So I'll do that. And if something comes to your mind, feel free to either put it in the chat or raise, or raise your hand. So one of the things regarding Sheila, um, regarding CDOC and becoming involved, if you would just clarify, at any time can someone express interest in becoming involved, or is there a particular time of year or a particular point where you can express interest in becoming a member or becoming involved?
You can become a CDOC member at any time of the year, any day, over the weekend. Feel free to check out the website or the membership form that my colleague Joyce had dropped in the chat. If you're first time hearing of CDOC today at this call, feel free to click that link and then it will direct you to an MS Teams form of this new CDOC membership form.
Okay. And then if you could just say a little bit more about the implementation guides that you mentioned, is that something that's just kind of very brief, or is it, sort of detailed, multiple pages, lengthy, or what have you?
It's an overview. So it depends on the key audience. For example, the key audience is the health system. We pull out key information from the upcoming state cancer plan and we summarize it into these implementation guides. Some of the guides are usually 1 to 2 pages long, or at the most is 3 pages. So it's a concise information for anyone doing cancer control efforts and would like to share the state cancer plan in their network if they're a health system. And then it gives you practical action steps on how you can use the plan, and it gives you the different action steps and strategies on how to be proactive in the cancer control efforts in your network.
Okay. And is there one for those of us who are part of the cancer centers? Is there one for us that we could request or what have you?
I believe the cancer centers is on our phase 2 of the development. For the phase 1, we do have health system, and I know a
Okay.
lot of cancer centers are belong in that umbrella.
Okay.
And Shante did comment on the chat as well. And yes, we will be able to present a variety of groups.
All righty. So going back to, oh, well, I actually had one more question for you, Sheila, and that was, I think I saw a slide or something that talked about sharing your involvement or ways you've used the plan. If you just have a quick example of maybe something that how someone has shared how they've used the plan or implemented a component of it.
Sure. For example, we do have members that have efforts of doing HPV screening, and then they would email Joyce or use our I believe it's on MS Form now, on sharing their activity involving the HPV screening efforts. And then we publish it on our newsletter, we highlight it in our CDOC website and things like that. So any activities, so if you have access to the state cancer plan from the previous, the one that ended in 2025. If you read through the strategies in there, and it's arranged by chapters as well, like early detection, primary prevention. If there's like a specific goal that you're if there's a specific goal that you are doing in that chapter, you could easily email our CDOC team and share like, oh, you know what, we have an activity pertaining to that chapter. We'd like to share our success story with regards to that.
Right. Thank you. And I'm just going to ask one more question to now Oliva, and let other people ask their questions or make comments. So, Oliva, there was one point where you mentioned the 24/7 service, call-in service, and it's serving more than two or around 200 languages. So, if you could just say a little bit more about how that works. So, if a person calls in and they're monolingual in one language, does it kick in to direct them to the appropriate translator, or do they actually need an English speaking person to, call in with them or what
Yeah,
have you?
you know what? That's actually a very good question. I wish I had the answer for you, but I don't. But I can get you that answer shortly. I believe it would be kind of like if you speak English, press this one. If you don't speak English, press this button type of information. But I will confirm that here soon.
Okay. Yeah, I was just curious about that because that's
Yes, that's a very good
a lot of
question.
languages.
Yes, yes. It's a very good question.
We covered that many because sometimes, we run into people who need support.
Absolutely.
Okay. All right. Others? Others on our group who would like to chime in? I guess the group is quiet and shy today. But you guys did just a great job with all of the great information. And then we see a number of links that people can access and save for additional resources and information. Well, I'll give you another minute in case somebody has something else, and then we will go to our announcements and updates segment. So if something comes up, feel free to chime in for Sheila or Oliva. And once again, thank you both for that's just the wealth of information. And as you saw with the reactions, people had a lot of, they learned a lot, or they're going to engage further with the information you shared. And go ahead, Oji. I just saw
Thank
your hand.
you. Hi, a question for Sheila and the team. I don't know if I missed it because I joined late. When do you anticipate the new plan will be launched or revealed or roll out?
I'll let Shante answer that question. Go ahead, Shante.
Hi, Ojig. Hi, everyone. Unfortunately, we don't have a date of when the plan is to be approved. It is going through the CDPH approval process, and it's kind of out of our hands once it's in that process. I will say that it's moving along, and we have great support from the department. So I'm hoping in the coming months, I can't say weeks, it will be approved. But I also want to say that although it's not officially approved. We are planning to have a face-to-face partner meeting in September at the California Endowment, where we will be talking about implementation of this plan. So we are working on our implementation plan, and we will be moving forward no matter what. So hope that answers your question, Oji.
Yeah, thank you so much.
All right, thank you. So I'm going to transition us over to some announcements. Some of the information that we had are announcements that people had already shared with us and asked to if we can help make them available at today's meeting. So I'm going to go ahead and do that. If you have another announcement, please be prepared to, or resource or event to share, please be prepared to share that either in the chat or by using our raise the hand feature. If you want to connect with our office further, please go ahead and capture either from the chat or from our QR code how you can reach us further from the range of, if you want to talk to us more about any of the items listed on the slide. And then here are some of the announcements that were sent in. So coming up this week, those who know of individuals or you're working in the prostate cancer space, there will be a prostate cancer patient conference this Friday. It is an event that you can join both in person or via webcast. So go ahead and check the chat to be able to grab the link for more information. And they also have the agenda posted, and registration is, advanced registration is required for that event. We also received information about the African American Community Health Equity Council is relaunching. That is a council that covers the city and county of San Francisco, and they will be having their kickoff meeting this Thursday. So please go ahead and capture the code there if you're interested in registering. Whether or not you're able to attend the meeting or you know someone who might want to attend it, at least you can be able to pass the information along. Other resources that we have received are regarding the San Francisco Bay Area Susan G. Well, I guess it just goes by Komen now, the Komen Empowered. They will be having a seminar focusing on breast cancer. It will be in person at our UCSF Mission Bay facilities. So go ahead and check that out if you're interested in registering, or please spread the word with others who would benefit from knowing about the information. We also have Soul Stroll, which includes not only a physical activity component, but also a community health fair, and community screenings are also a part of it. It's held in San Mateo County, and that's coming up on May 16th. So go ahead if you're interested in learning more information about Soul Stroll or potentially being a part of the community health fair village. You can connect with the link in the chat to learn more or to express your interest. We will be at Soul Stroll, we being our Office of Community Engagement. We'll be participating in the community village there. We also will be participating in the Health and Wellness Pavilion at San Francisco Carnival, which is coming up on May the 23rd. Also coming up, we received information from the cancer support community that they're having a walk and community health fair also on May 16th. And that will be in Walnut Creek. So please capture the information about that and spread the word for others who, regarding the Hope Walk and Community Fair. And then we also received information about a Walking to Live, Celebrating Life. It is also a walk with a focus on cancer survivorship, as well as it includes a health fair component, and that will be held in Oakland. So a couple of things. We've got a couple of things, and we've got Walnut Creek, Oakland, San Francisco, and then San Mateo with the Soul Stroll.